This is a band-resisted tibial internal and external rotation. So tibia is the lower leg bone. I have a band just on the leg of my treatment table, so find something you can anchor to, a desk, a kitchen table, something like that. And I'm going to be mostly on weight slightly to my heel because I want to pivot my foot. So I don't want to pick my foot up a ton, but just maybe a little more pressure on your heel and wearing socks or something that slides on the floor you're on. From there, I want to get my femur and knee pointed straight because then I want to get rotation into my tibia. So the tibia has some rotation to it, and that can affect how the knee and the ankle feel. And so this direction, my left leg going to my right, that's tibial internal rotation, and then the band moves me to external. And the key on these, I'm going to show the other direction in a second, is I want the tibia to move, not my whole thigh. And so it might be a small motion, but I want the tibia moving, not the thigh. And then I find it helpful to take the hands and just kind of guide it. This can also be a little self-mobilization of the knee. So I'm not really doing a lot of work with my hands, but I'm feeling here's the front point of the shin bone, the tibia. And so I'm feeling where is that? I can feel that. And then just gently clasping hands around the top of the calf and making sure that it's the tibia that's moving, not just my ankle and not just my thigh. So that's tibial internal rotation. I want to go as far as I can and work with control on the way back, not just slamming it back. And then I'll work the other side. So if you're working one side, you would turn around. Just for the camera, I'm going to show my other leg. Same thing, same setup, but now the band is pulling the other way, and I come here. If you're fresh off something like a rolled ankle, this might be a little uncomfortable, so of course don't continue this or work in a range that's comfortable for you, but I'm trying to get the point of my tibia rotating. This one might feel work outside of the leg, the other one hopefully maybe work a bit on the inside. But usually we don't do these super heavy resistance, but a little higher rep going into some muscle burn, and we can also use these to help free up motion of the tibia if that's been a goal for one reason or another in maybe a physical therapy plan. So of course check with your healthcare provider if you're dealing with any injuries. So tibial external rotation is going out, tibial internal rotation is going in. If you're doing the other side, just turn around. But I do like to do these with a little bit of focus because I want control. If I'm just kind of waving my foot around, that's not going to be what is going to move the needle if this has been something that's relevant for me. This is not something I typically do in a prolonged way. A lot of times this is for a focused reason to either hit some muscles, expose the ankle to something after some sort of roll, free up some motion, whatever it is, and then we progress on to something that is more dynamic or has a little more load. But for the right person, the right circumstance, these can be particularly helpful.